Today, I'll present the Health Emergency Operating Center's report using the PowerPoint format. Today is Mother's Day. Today, we salute all the mothers in the Federation of St. Kitts and Nevis. You are the stalwarts. You are nurturing the children of the Federation. On behalf of the Ministry of Health and the Health Emergency Operating Center, we wish you a happy Mother's Day. The new coronavirus has infected 3,917,366 persons and has killed almost 275,000 persons internationally. This microscopic organism has locked down cities around the globe. This microscopic organism has caused significant changes globally. It has caused economic changes, social changes, and even geopolitical changes. In St. Kitts and Nevis, so far, we have tested 332 persons. We have confirmed 15 positive cases, 312 results returned negative, and at present, we have 5 results pending. Now, last evening, I received a question, and I'll read. I still don't understand the reason persons are not tested immediately they are quarantined. Would you indulge me with an explanation? And so let me explain. Now, for example, persons who have recently come into country from Jamaica, for the Jamaican students who were repatriated, they were not tested immediately upon returning to the Federation. Because if we had done so, the students would have to be subjected to about 2 or 3 samples and tests. I tell the students that the procedure is not painful, but it's a bit uncomfortable. And so to avoid that, the students or the persons in quarantine, they are tested within the 14-day period. To be more specific, they are tested towards the end of the 14-day quarantine period. Because if we test them on day 1 or day 2 and the sample is negative, that does not mean that they are negative. In another 2, 3, 4, 5 days, if you were to resample and test, that sample can come out positive. And so based on the foregoing, I want to state that a negative RT-PCR test result during the quarantine period does not shorten the period of time the individual has to remain in quarantine. We have 15 cases confirmed. Our first case was announced as far back as the 25th of March. Our 15th case was announced around about the 19th of April. We have 11 cases confirmed in St. Kitts, 4 cases confirmed in Nevis. Today, there are 56 persons quarantined in a government-assigned facility. There is 1 person quarantined at home. There's 1 patient or confirmed case who is isolated and is recovering nicely. And to date, 756 persons have been released from quarantine. We have 14 cases who would have recovered, 10 on St. Kitts, 4 in Nevis. And as I said earlier, 1 case is recovering nicely. The average duration between the time of diagnosis and recovery is approximately 30 days. And we have achieved these gains through the comprehensive operational response I would have explained a few days ago. I want to highlight that the national statistics can be found on the websites as highlighted, www.covid19.kn, and you can find the information also on the St. Kitts Health Promotion Unit Facebook page as outlined on the slide. On behalf of the Ministry of Health and the Health Emergency Operating Center, I want to hand deliver a gift, a special gift, to the mothers within the Federation. Now, it's not a literal gift, it's somewhat figurative, and it's our COVID-19 situation. As a mom myself, we would have woken up this morning in the Federation of St. Kitts and Nevis in the middle of the fight for our lives, fighting against the COVID-19 virus. And guess what? The situation is under control, and it's with pride that I hand you this gift. Happy Mother's Day. Thank you.